Welcome to the Brilliant Fertility Podcast. I'm your host, Dr. Katie Rose, and this podcast exists to help illuminate the path ahead of you. With expert interviews, clinical pearls, and real client success stories, my intention is to bring you hope for what's possible on this journey and to give you tools and resources to navigate the ups and downs on the road before you. If you find this podcast helpful, don't forget to subscribe on your favorite listening platform. And I have a big request. If you have a minute, can you leave us a 5-star review? And let us know, what did you learn? What did you come away with? Did you leave with that spark of hope? This helps more people like you find the podcast. My mission is to support as many humans as possible on their path to become parent. And by you sharing and subscribing, you're part of that mission too. And I'm so grateful for you for being here. Welcome back to the Brilliant Fertility Podcast. I am so excited for today's guest. We go way back to like another lifetime in medical school. And so I was really pumped when she said yes to this interview. I have Dr. Nicole Cain here with us today. And Dr. Nicole, like, she has such an amazingly educated background, but I'm really excited to dive into her story about how she got here. She is the author of the acclaimed book, Panic Proof. I've got my copy right here. And leading expert in trauma-informed and integrative approaches for mental and emotional wellness. She has a degree in clinical psychotherapy, training in EMDR, and is a licensed naturopathic physician in the state of Arizona. Her approach to mental health is truly multidisciplinary with a medical, psychological, and holistic approach. Dr. Nicole, thank you so much for being here.
This is great. I've been looking forward to talking with you.
Yes. So I'm always curious to know what leads people to what they do, because this is truly a calling. Like, I think it takes a certain type of person to be in the world of mental health, but also to approach this in a completely revolutionary way.
When we started medical school, and I wonder if your class did this too, is we did the talking stick exercise. Did you guys do that? Yeah. And I noticed as we were going around the room, and so for those who haven't done this exercise, it's a Native American tradition, and you have this big stick. It's called the talking stick, and the person who's holding it will be the one who's speaking, and then you can add something to it that represents whatever it is that you're talking about. And in this example, we were talking about our why. We were talking about why we're here at naturopathic medical school. And I remember noticing as we went around that circle with everyone in my entering class is we're a lot of wounded healers. We're a lot of people who are just trying to figure it out, either for ourselves and for other people. And at that time, I talked about, I had these beautiful dried purple flowers that I added to our walking stick, but I was just trying to figure out my way. And that journey definitely changed. And it took some ups and downs since that time. But really the TLDR, the too long didn't read, is that I wrote the book that I desperately needed growing up. I needed to know that you can actually heal from anxiety. And for so many of us, that is a myth. And for so many of us, everyone will tell us, no, that's not possible. But I was out to prove that wrong. I was out to prove to myself and everybody who would listen that you can heal from anxiety. So that's where my talking stick ended up going.
Yeah, I can relate to that so much. My talking stick contribution was an empty bottle, an empty prescription bottle for antibiotics for all of the recurrent UTIs that I'd had over the 5 years prior to starting medical school. And I wanted that to be the last antibiotic that I ever had to take for such a thing. And so hearing that we're all wounded healers, or many of us came into this profession because we had our own struggle, our own hero's journey to,
Yes.
if I could just help one person not have to go through what I go through, that was my why as well. And it changed, of course, with fertility over the years. And I think that, when we have that level of why, when we've been through it and we can relate to what our patients are going through so easily, and then to have a solution, a very real solution that gets to the root cause. And what I really loved about the book so much as I was reading the introduction was how you talk about our body just wanting to communicate with us. That we may have this assumption, or maybe society has this assumption, that when you present with symptoms, there's a part of you that's broken. And we have to fix it. We have to mask it. We have to medicate it. And it doesn't allow us to truly listen. What is this very wise body wanting to communicate? And I loved it so much because that's how I've been talking to my infertility patients and clients for years. And it might be so hard to hear it at first because, like, what are you talking about? Like, everyone, I just feel broken. Everyone has told me that there's something wrong with me. And it's this very new opportunity to do things differently.
Yeah. And trying to figure out what do I do then when I have this information? Because suddenly the tools that we use to respond are really different versus staying in the realm of anxiety for just a moment. Is if I'm having a panic attack and my heart is pounding and my fingers are numb and my brain is racing and my gut is churning, the solution is either an antidepressant, trying to talk yourself out of it with a bottom down or a top down therapy, or a benzodiazepine like Xanax. But then if we change our perspective to, oh, the words are important and they're meaningful, and we can actually listen to those words to heal, suddenly it's like, well, now what do I do with that? I've been trying to suppress and ignore this my entire life. This whole new way of looking at it can be really overwhelming and scary for people.
Yes, absolutely. I very much feel strongly that this is not a DIY situation. DIY is for crafts. It's for repainting your
Yes.
bathroom. It
Yes.
is like, this is a situation in which having a trusted provider who is trauma informed, and potentially a community who is working together to co-regulate, is really important. I want to put that out there. Like, I absolutely recommend you all go out and get the book and follow Dr. Nicole on Instagram and listen to the podcast. And you don't have to do this alone.
Yeah.
So
Yeah.
with my clients and my patients who are coming in with infertility, of course, I'm rarely their first stop, right? They've often been through quite a merry-go-round with Western medicine, potentially having already gone through IVF. And we get into this situation where sometimes it's hard to tell, like, what's the egg, what's the chicken with anxiety and fertility struggles. Because when I do my history, I'm always asking about their mental health, their gut health, their support systems, their trauma history. So we're getting this really wide bird's eye view of what their upbringing as well as this current history has been like. And so many of them report that they've always been anxious.
Mm-hmm.
And then they start to go through fertility struggles, and it just magnifies every anxiety they've ever had. And then we get into a vicious cycle where the anxiety is potentially getting worse. They're potentially experiencing panic attacks on top of, the low level anxiety. And what worked before might not work anymore. Or the medications that had kept them feeling stable before, they can't use when they know that they're going to be getting pregnant. And so that, magnifies it even further, and everything that's been suppressed for potentially decades is now popping up, and it can really flood the system with overwhelm. So for the people who are coming
Yes.
into my world like that, where would you start?
Well, I really want to honor that you're looking at origin story, that you're looking at the beginning. And I think that's really, no pun intended, no Disney movie intended, but the very beginning is a very good place to start, right? I'm thinking of Disney movies while I sing, while I talk this, I'm singing it in my background, in my mind. And that's because what we're seeing with the trauma informed model is that we inherit information about how to survive from our ancestors. And we've seen, like with the Dutch famine studies, which they looked at people like Audrey Hepburn, they went through the Dutch famine, and then there were epigenetic changes that took place that we're still seeing in their descendants generations later. And we've seen this with animal studies, is that something can happen 6 generations back that could still affect the descendants today. And so we know that we've inherited mechanisms for survival from our ancestors. Even before we come out into the world as an individual, the tendencies that we have start as we're being created genetically. And then every single experience that we have is being logged away by the brain and the nervous system, and it starts to build around that. So you're in the fetal environment, and whether your parents were feeling safe or feeling stressed, or they had environmental toxic exposures, or they had a good gut microbiome, or they took the antibiotics like you talked about. So many of us have taken round after round of antibiotic. And then we are born, we get our gut microbiome is from our biological mother, and that gut microbiome is going to set the stage for our gut health, our hormone health, our immune system health, our nervous system health. And then we have all of these experiences. And so everything that does happen to you and everything that doesn't happen that maybe should have happened to you is being logged away. And the brain doesn't care about your well-being. The brain cares about your safety. And so those beautiful, wonderful, positive things that happen, the brain may or may not log away as strongly as those little things perhaps that were unsafe or scary. And so then the entire body will orient around that. And what's really exciting is that in the research, we're starting to see how Bessel van der Kolk was right. And the body does keep the score. And we're starting to see links between early childhood experiences and later life, whether that is fertility in cisgender men or cisgender women. We're seeing even bone fracture tendencies and cancer tendencies that we can largely explain by early childhood experiences. So our origin story is really important. And so I want to honor that you are doing that and that you are teaching that, because if we could figure out the root of the root of the root and start to recalibrate that and start to reprogram that, the body is designed to heal itself. And oftentimes, if we can go to the root cause and follow the therapeutic order, which is something that's uniquely naturopathic, that teaches us how to think about health and wellness, by following just those simple guidelines, most people do get better. And healthy people are able to reproduce. And oftentimes, not everybody, but we can often make huge differences and help people to have healthy babies. So that's the first thing is I love, Doc, that you're starting with the origin story. And so for those who are listening to this conversation, that's one actionable that you can write down right now, is write down origin story. And then what you're going to do is you're maybe going to take a list of all the symptoms that you experience right now, whether it's heartburn or restlessness or allergies, or maybe you have really terrible menstrual cycles, or maybe if you've had your sperm tested and there's low motility. Whatever it could be, is you could write those symptoms down, and if you have a way to follow those symptoms back, that's amazing. But even if you don't, is just imagine drawing a timeline and seeing if you could follow it all the way to the beginning and ask yourself, what is something that happened or didn't happen that I had to adjust to? Something that may have changed the way that I see myself, the world, and others, or something that affected my health. And then we have a place where we could start doing some of that root cause digging.
Yes, I love that you say that the root of the root of the root,
Yeah.
because oftentimes with just the way our system treats different medical conditions, they're like, oh, you have heartburn, that doesn't matter. Like, oh, you have
Right.
anxiety, like that doesn't affect your fertility. But we can't separate these systems out in the body. We can highlight certain areas. We're like, oh, if you experience anxiety in this way, there may be more of this happening in the endocrine system, in the nervous system, in the immune system. But all of these systems are communicating with each other at all times.
Yeah.
So we can't look at one system in a vacuum and say, sorry, your digestive health is not related to your hormonal health in any way, shape, or form. Like there's so much happening in the body. So what I would love to give people an idea of is with anxiety specifically, there are different forms that it can take on. And you've highlighted in the book 9 different types of anxiety. What are those different types? Because some people might be experiencing some of these symptoms, but not even realize that that's anxiety that is producing these symptoms.
Yeah. And one of the biggest myths about anxiety is that it's that you don't have it. And so someone may be running around and they're irritable and they're frustrated and they feel rushed and they just don't talk to me, don't interrupt me. Well, that could be the fight part of fight, flight, freeze. It could be
Oh, that's
anxiety.
that's one of mine.
Yeah, yeah, anger anxiety. And so it's anxiety that shows up primarily with a lot of frustration. And by not knowing that it could be anxiety and what could be going on underneath of that, we're missing an opportunity to listen to the message from the body and do deeper healing. And so to figure out the 9 types of anxiety is I do have a free quiz everybody can take. You can find it at drnicolecain.com, and I'll make sure that you have the link. And there's a real benefit to knowing the type of anxiety. And one is that it allows us to be a lot more tailored in our treatment approaches. Instead of just, oh, you're anxious, I'm going to put you in a bucket of treatment, talk therapy, antidepressants, and benzos, is now if we get a little bit more specific, we can treat you a little bit more specifically. So the 9 types, let's go through those, and then I'll give you some real good concrete examples. So the first type is anxiety that shows up in your thoughts. And so maybe you get really worried thoughts, obsessive thoughts, intrusive thoughts. Maybe you're future tripping and you're like, oh my gosh, like what if you're doing IVF? Like what if this happens or this doesn't happen? Or what if this terrible thing means this terrible thing, right? Your brain is just going down all sorts of those rabbit hole spirals. That's thought anxiety. And the treatment for thought anxiety will be different than if your anxiety comes from, let's say, your gut. Gut anxiety is anxiety where you can have gas or bloating or reflux or IBS or diarrhea or constipation. And treating the gut with the gut brain axis is so powerful for gut anxiety. And we could definitely get into that more. And the next type is chest anxiety. And so this is anxiety that shows up where you feel like, oh, I have an elephant on my chest, or my heart is racing, or I can't get enough air. And then we have nervous system anxiety, where sometimes people's anxiety, it just shows up in the muscles, the nerves. I'm kind of shrugging my shoulders as I describe this because you see some people, you walk behind them and you just want to take your hands and push down on their shoulders. They're shrugging, they're so tense. And some people, they get that, oh, I can't feel my face or my tongue, or I get like zapping pains. I had a patient who used to lose her vision during acute panic attacks. It's nervous system anxiety. And so we have specific herbs and remedies and root cause testing that work great for nervous system anxiety. And then we have endocrine anxiety, which is where I think we'll focus a little bit more on today. Endocrine's hormones. And so this could be how your anxiety is affecting your hormones, or vice versa. It could be that your hormones are making you anxious, whether it's thyroid or cortisol or sex hormones like estrogen, progesterone, testosterone. And so we really want to look at this, and I see it being missed all the time. I write about Charlotte in the book, who had a pretty big case of hormone anxiety and was told that it was just postpartum mom baby weight. And so we'll get into that. I think that'll be important for your audience. We have immune system anxiety. So this was really huge for me. I was studying mast cells and I was studying the immune system and this whole branch of psychology called psychoneuroimmunology, which is where I got my master's. I studied that at Luther College. And there's a chemical, and this chemical we know causes stuffy nose, congestion in the eyes, itchy, watery eyes, maybe even skin rashes.
Mm-hmm.
I'm thinking of histamine. I'm wondering what you were thinking of.
Oh,
Yeah.
absolutely. You think about the people who have like the stress reaction of getting hives, for
Yes,
example. Mm-hmm.
exactly. And histamine can be as stimulating as adrenaline. And
Absolutely.
so
Yeah.
if for example somebody has a histamine, they're not detoxing properly. Let's say they have an issue with methylation, which is like a whole other conversation pertaining to fertility, but let's say they have an issue with methylation. They're not draining histamine. And so they only feel good when they take Benadryl, but we can't live off of Benadryl. And in fact, the research is showing that it can cause cognitive issues later down the road. And so the question that we get to now ask is, well, what's going on where they have high histamine? Oh, we could support methylation and that will help with mood, fertility, histamine. What? It's so much better than just giving you an antidepressant, right?
Yes. Yes. And it's the root of the root in
Root
a
of the
situation
root.
like this. Yeah.
Exactly. And then we have trauma anxiety, and really trauma anxiety could be the umbrella of all of them. I have parsed it out as the one of the 9 types because if the main thing for you is this thing happened and you've never been well since, whether it's I got this like horrible infection, or I was exposed to this really life-threatening event, or I had this loss. And so if the main thing is nightmares about the event or flashbacks or intrusive thoughts, then we really want to focus on doing trauma specific treatment like EMDR or internal family systems or somatic based treatments. So let's see. And then we have depressive anxiety, which is anxiety where you also feel despairing and hopeless and tired and lethargic, which can be more. I see this a lot with menopausal women. It's a flop kind of an anxious response. And then, of course, we began the conversation talking about anger anxiety. So I think we covered everything.
Yeah. And I think for those of you who are listening who have identified perhaps with having some anxiety, this may give not only some background and like, oh, there are different ways that this can manifest. So maybe it's not just a depression. I'm not just lazy with the
Right.
flop, right? I'm not just an angry bitch, right? Like there may be something underneath that, and it is an opportunity to heal. It's an opportunity to look at something differently.
Mm-hmm. Mm-hmm.
With infertility, of course, hormones are really important thing to look at, especially, well, both in men and women. I think men get left off the conversation far too frequently, even though they're 50% of the DNA contribution.
Right.
But with both of them, like there's a huge hormonal involvement in, women in the maturation of their follicles, in, how their immune system and their blood flow is being signaled in the uterus and the endometrial lining. But in men in sperm production, like we need to have healthy testosterone output. But when you talked way back in the beginning of this conversation about the epigenetics, semen analysis can't tell you what the DNA inside a sperm is doing. So when we're talking about epigenetics and the ability for genes to be turned on and off, this conversation is so important. So with endocrine hormonal anxiety, what would be the top symptoms that we're looking for to key us into whether that's part of the anxious manifestation?
So if we look at women, there are mercifully more symptoms. And more symptoms is our body's way of telling us what needs healing and how. And so when you have symptoms, say, oh, thank you, body, for communicating to me. I'm listening and I'm going to bring this information to my doctor and we're going to figure out how to help you be healthy. So we're going to start to begin the process of changing our relationship with our symptoms. And so let's say that you have had a lot of difficult periods growing up. We'll just give that one example. Maybe you were given a diagnosis of PMS, or maybe polycystic ovarian syndrome, or maybe you were given birth control most of your life and you didn't have periods. And so you have a hormone history. Every person, cisgender female, you have a hormone history. And that history is going to tell us an awful lot about what your fertility journey may be like. And so what we're going to want to do is we're going to want to go back to your origin story, yes, and we want to collect data about how old were you when you started your period? What was your period like? What treatments did you use throughout time with your period, if any? Oh, some patients say to me, oh, every month it was so terrible. I had to take all these painkillers because the pain was just so awful. And I've had lots of laparoscopic exams and I think endometriosis, right? So all of that data is important because it tells us about the health of your hormones. And so you want to get that information. And one thing that I commonly see in these individuals is, well, I went to my doctor, I had my hormones tested and they're fine. Ooh, yeah. That's tricky, right? When your lived experience is every month I dread it because the pain is so bad or my symptoms are so bad or I have mood swings, but the doctor says everything is normal. And ooh, I have so much compassion for you women who are listening to this that are like, yeah, I've had normal testing done all my life. And oftentimes it just means they're not looking at the right thing because your body is trying to give you information. And so if you resonate with this and you've had a difficult hormone past, is I think that there's better testing that can be done. And I know that you'll learn about that a lot throughout this podcast while you listen to this episode and many others, is oftentimes if we have hormone-based symptoms, but the tests, like the blood tests, look normal, it could be, number one, that you have an environmental toxic exposure, or number two is you could be dealing with phasic vulnerability. And so this matters because if we can figure out what it is and then we treat that and make you healthier, then you're going to be better prepared for pregnancy. And if you do IVF, you will respond better to IVF. So your first step is to journal, write down your symptoms. And if you have a lived experience of abnormal periods, abnormal cycles, difficulties, then getting environmental testing might be a really good next step for you. I love looking at mycotoxin or mold testing, and I love looking at metals. And so, for example, lead, mercury, even really low levels, you get your hair done, you get your nails done, you use cosmetics, you wear lipstick. Mm-hmm. those metals can look similar to the minerals that your body needs for hormonal pathways to work. So you can have plenty of estrogen, but if that zinc has been replaced by a metal, it's like putting a cog in the wheel. It's like trying to use baby toys to fix a car engine. It's not going to work properly. But the numbers are normal, right?
Right. Like you're still producing, like that's the level of estrogen that's circulating in the bloodstream at that time of the
Mm-hmm.
cycle. And it can look normal, but it doesn't mean that it is binding to the receptor sites in a normal way. It doesn't mean it's being metabolized in an optimal way. And so the effect of that, if our body is like a barrel and we have like a certain threshold that our body can hold of these environmental contaminants, and it's just going to take one little extra exposure to sort of have that barrel start overflowing with symptoms.
Oh, brilliant. Yes, yes, that's brilliantly said. And there are great free quizzes that you could take online, like exposure history. I think Horowitz has one. You're looking for mold. Jill Krista has a really good free quiz that you could take. And so it's just a way to gather some information. And so that would be a good place to start is if you have had abnormal imbalances or if you've taken medications your entire life, you might want to look and just make sure, are there obstacles to cure for me? Are there environmental toxins filling up that barrel? And could they be getting in the way of healthy pregnancy? And this could be the same for cisgender men as well, is that if you've been exposed to a lot of toxins, it's going to affect sperm quality. It's going to affect the number of sperm you produce. It's going to affect their motility. And so I encourage you to do this with your partner if it's not cost prohibitive, is you'd get tested and dad gets tested and make sure that all of that is normal and healthy. And the second thing hormonally is the way our hormones are interacting with each other and other parts of our bodies. You said it perfectly earlier, is that our bodies don't just exist in closed systems. And I know we've done this with medicine where it's like, oh, it's in your gut, go to the gastro. Oh, it's in your bones, go to an orthopedist, right? Everything is separated, but it's just not the way the body works. Everything affects everything else. If you drink alcohol, you're going to feel that everywhere. You're going to stumble and you're going to throw up and you're going to feel dizzy and you're going to have it show up on a urine test. It's everywhere, right? And so you want to make sure that you're looking at the whole person. Okay, so the second thing to think about is chronic stress, which is a really big relevant part of the conversation I think right now, is
Yeah.
that we're all so overstimulated and overstressed. The brain will get billions of data points a moment. It's coming in from the environment. We get these data points coming in from the body. The insula in the brain is, oh my goodness, I have to filter through all of this. This is so much. But then we add news sources and headlines and tweets and all these different data points from all around the world. And now this brain that's largely a caveman brain, because DNA evolved so slowly, humans evolved so slowly, is now we're overstimulated with all of this data. And then what can happen is an overstimulated brain is like, I don't know, I can't handle all of this. When in doubt, we're going to just dump it down to the amygdala, your emotional processing part of the brain. And the amygdala is like, this is too much for one little amygdala to handle. We're just going to, when in doubt, send it on. And so now we have an activation of the hypothalamic pituitary adrenal axis, which is the process that your body goes through in order to become activated. Because when in doubt, we got to run from a tiger. Because remember, your brain is much more concerned about your safety than your well-being.
Yeah.
So if you're stressed, if you're not being really, really mindful to audit stimuli coming in, and you have lots of responsibilities and you have lots of interruptions and you have lots of stimuli just from maybe work or maybe other kids in your family or maybe even your past, maybe you get really overwhelmed because of your past, your body is getting this constant trigger of that fight, flight, freeze, flop, fawn, fracture response, right? And so let's just say that many of us are starting there. And so now we can take this conversation a little further. So we talked about your hormones are quote unquote normal, but your lived experience is that they're abnormal. And so then we talked about environmental toxicity and what to do next. This example is theoretically everything is normal, but you are completely overstimulated and you're completely overwhelmed. And so we're going to camp out here for just a few minutes. Before I elaborate, I know that this is something that because I've watched your content and I know you know a lot about this. What do you want to
Oh,
add?
I love talking about this because
Mm-hmm.
it's extremely relevant to current times. And the conversation around stress, I think, can get a little. I'm mindful of how I present that because there's so much misinformation as well. Like people are seeing their doctors like, no, 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 stress doesn't cause infertility, and like, no, maybe that's not the root, and it's not helping. And it also feels really crappy to be stressed out all the time, even if you don't believe that it's impacting you because you're so adapted to that chronic stimulus that it almost becomes an addiction, right? Like the idea of slowing down, of having calm, of having safety is like, when's the other shoe going to drop?
Yeah.
It doesn't feel normal to be unstimulated and quiet and calm and safe. And so it can be a really interesting unfolding of witnessing that and acknowledging it. And I love using tools like understanding how someone's heart rate variability is presenting, or doing like a CO2 breathing test, because that highlights for people, oh, I am being impacted by stress and I didn't even realize it. And that gives a new path to like, okay, well, now we can use different tools now that it's been acknowledged. Like if we're just totally in the dark about it, then we can't do anything about it. But now we have awareness and we can
Ooh,
start
girl.
there.
Brilliant. So good. So let's actually use an objective tool during our conversation for this today. This
Mm-hmm.
is so good. So not all of us have heart math to do heart rate variability or CO2 test, but you do have a pulse and you are going to learn how to find it. And so if you could watch this on video, this would be great. But for
Yep,
those
this will
who
be
are
on
listening,
YouTube.
so go find it on YouTube. If you're struggling to find it, then that's okay. Just watch other YouTube videos how to find my pulse. But I'm going to try to describe it because we're going to walk through something that's applicable here. So when you go to the doctor, they feel your pulse in your wrist. And so this is going to be on the side of your wrist where your thumb is. And you're going to try to find this bump that's in your wrist. And so there's a bump here. So you follow your thumb down to the bump in your wrist, and then you're going to just put flat fingers on your wrist side. So yeah, you're demonstrating it there. So for those who are listening, is you're going to try to find the pulse in your wrist. I often recommend for beginners not knowing where your wrist pulse is try to lower your wrist below the level of your heart, let more blood flow go down there, and just try to use flat fingers. And if you're really like, I want to do this exercise, but I can't find it, then you can feel your neck gently, or you can even place your hand on your chest, feel your pulse in your heart. I'd really want you to practice finding it in your wrist, but for now, find it wherever you can. And what we're going to do is we're going to spend less than a minute, and I'm going to teach you about your heart rate variability. And so what you're going to do is you're going to just notice for a couple of moments the speed of your heart rate. You're going to feel it beating underneath your fingers. And then I'm going to walk you through different things you're going to do with your breath. And while you do that, you're going to pay attention to your heart rate. I want you to pay attention to, does it speed up or does it slow down? Or does it stay the same? So the first step is let's get our baseline. So let's just notice speed. And then I want you to inhale with me. We're going to do 4, 3, 2, 1, and then hold at the top, maybe even bear down. And now we're going to exhale a big sigh. 5, 4, 3, 2, 1, 0. Let's do that one more time because now we have the dance stuff so we can pay attention to the pulse. So you're going to inhale, 4, 3, 2, nice and big. You're going to hold at the top, 2, 3, 4, 5. And now you're going to sigh, big exhale, 5, 4, 3, 2, 1. And I know you know what's supposed to happen, Doc, but can you tell us what you noticed?
I noticed my pulse slow down. Like I
Mm-hmm.
noticed that when I really bring awareness to the breath and I bring attention to the breath of slowing the breath down, that it overall slows the pulse.
Yes. And so when we inhale, that activates sympathetic, which is that activation, that fight, flight, freeze, right? And then when we exhale, that delicious sigh, the second half, 5, 4, 3, 2, 1, is that's activating parasympathetic, which is calm. So here's why this matters is if you do this exercise and your heart rate stays really hard and fast the entire time, then that tells us that your body is more stuck in activation. And that means that it's not getting, your heart's not speeding up when you need it to and slowing down when you need it to. You want to have a heart rate that's pretty variable. It's kind of like I use like a loosey-goosey yoga heart rate. Like you want it to be able to ebb and flow depending on your breath and what you're doing, as opposed to a heart that's more like a metronome. I think about the British Garda and like they're really rigid and they're not flexible, is that's a nervous system that's really stressed. And so that's one thing that you could start practicing doing is you want to practice doing this where maybe just a few times a day is you take a big breath in, you hold it at the top, and then you sigh. And you're going to be tonifying your vagus nerve. You're going to be strengthening your vagus nerve. You're going to be practicing making your body more fluidly able to shift from stress to calm. But let's say that, like many, that you didn't really notice the shift and the body is on a high stress state. So we're going to go down a theoretical what, and that doesn't mean that that's the case for you. It doesn't mean anything exactly for you. It's just data, but we'll see theoretically based on clients I've worked with is let's say that your body is getting all that stimuli from your environment, from your interior experience, whatever's happening. Maybe you drink a lot of coffee, whatever it is. Let's say that your body is in a state of fight, flight, freeze, right? And so hormonally, now we have a change. We have high amounts of adrenaline, we have high amounts of cortisol. And so, how does that relate to fertility? Why does that matter? Why are we talking about stress and fertility? Well, we know that stress and stress hormone can suppress the release of gonadotropin releasing hormone. And we need gonadotropin releasing hormone for ovulation. And we also need it for sperm production. And so when we don't have proper signaling, your menstrual cycle can become irregular, ovulation can stop altogether, sperm count can decrease, motility can decrease. And think about it, the evolutionarily, your ancestors didn't want to be having babies when they were at war and when they were in a famine and when they were at danger. We want to have babies and rest, digest, and reproduce when we're at peace and when we're feeling calm and we have time to be quiet, right?
Yeah.
So now that high stress could be affecting gonadotropin releasing hormone. And we also know that cortisol can cause other hormones to go out of balance, like estrogen and progesterone and testosterone. You need progesterone for a healthy uterine lining, and that's really important in supporting early pregnancy. But if your cortisol is really, really high, the body may steal resources from progesterone production to make more cortisol, and that can cause an imbalance in progesterone, cortisol, and estrogen levels. And then we also know that IUI and IVF can cause stress, and that stress can cause more hormonal imbalances. And when our hormones are out of balance, that can affect our immune system, right? So cortisol, let's say that we have the example of high cortisol. High cortisol, one of its jobs is to suppress inflammation, right? And so our body uses cortisol for checks and balances. And so if inflammation goes really high, the body will try to combat that with cortisol. But if cortisol is really high, it can suppress your immune system. So you might find that you're getting all the little colds and you're getting every single little virus that's going around. Or you might find that now you're getting gut stuff and you never used to have gut anxiety. When our immune system is suppressed, our immune system that resides primarily in your gut, it's not as active. And so now you have these opportunistic infections. They can start to take over. They can cause damage in the gut. And then let's say that this is unchecked. And so let's say that you've had a lot of anxiety. Your doctor gave you an antidepressant that's been managing things for a while, but now you want to get pregnant. So they're like, you should come off your antidepressant. And so now your stress is higher, your serotonin's all whacked out because you're trying to come down. And now we have inflammation in the gut. You have these opportunistic infections that are coming in the gut. They're moving in, and now you have gut anxiety, and you're reacting to more foods, and you're getting IBS. And so now they're like, well, we could put you on a proton pump inhibitor, like the purple pill Prilosec. And all of this is happening beneath the surface, and meanwhile you're trying to conceive, and they're like, oh, it has nothing to do with it, but it's just like this vicious loop, right? So I want to hear what you think about that whole piece.
Oh, we see it all the time. Like all the time. And it's so funny because actually like right now there are a couple of people in the Brilliant Fertility program who have a long-standing history of gut issues and reflux issues. And now that they're trying to conceive, it's like, oh, well, like I was going to push that on the back burner, but I'm like, no, that is an important signal that gives us more information. So we want to continue to follow the body's signals because that could very well be connected to why this is taking longer than you thought it would to get pregnant, or how it's feeding into the stress response overall. Because I don't know if anyone is like me, who I definitely tend towards thought anxiety when there are already physical symptoms.
Oh, yes.
The physical symptom starts, and then the what ifs chime in. What if it's this? What if it's that? What if it never stops? What if it makes this happen? And it's like, that's a conversation that came up actually this week in the Brilliant Fertility program, which was, it's not funny, but it's just like, it's not a coincidence either, right? Like all of this is connected. And I think having this conversation at this time is like, I know is going to help so many people find a new way of looking at this. So if they are experiencing that cycle where it's easy to get your head in this place of like, oh my gosh, now what's wrong with me? There's so many things wrong with me. This is never going to happen. Being able to just say, hey, you know what? All of these symptoms are symbolic of something else it's an unmet need somewhere.
Yes, yeah.
And maybe it can be as simple as giving some tools to regulate the nervous system, giving some tools to build resilience to stress. There's going to be a bombardment of information for as long as we live. And so learning how to set boundaries with information. Like there may be some really simple ways of going about this, even if it feels like every system is being impacted somehow and it's really overwhelming. It doesn't mean
Mm.
you have to take 45 supplements and quit your job and never look at social media again. Like we usually will choose, 3 to 5 really sustainable practices that we can focus on to prevent further overwhelm.
Mm. I love that. And I like keeping it simple because I talk to so many people who they're spending all their time and all their money trying to
Yeah.
healthy themselves. And so, what I would love to add for your audience is a 4-step process for nervous system reprogramming. And so, we've been talking about the different types of anxiety. We've been talking about your origin story. We've been talking about information gathering from the symptoms. So, what are your symptoms telling you needs healing and how? And oftentimes, by putting one thing back in track that was like the real crux of the whole thing, the body will often self-correct. Think of it like dominoes. It's
Yeah.
like I just needed that one piece and now the whole thing is like it's all self-correcting. I often see that. It's like, oh, that was the one missing piece. And so I think keeping it simple can be really good. And for many of us, it's that our nervous system, our body has inherited programming from
Mm-hmm.
our genetic environment, from family culture, from whatever. And we can actually reprogram that. And that's the gift of neuroplasticity is the mind and body is incredibly adaptive. And all of these things that we've been talking about, you can reprogram. And generally, we see that it takes about 90 to 120 days to create a new habit, but you can do it. It can be really powerful. For example, I did this training in EMDR not long ago, and it was about using trauma informed therapies for pandas, which is an autoimmune symptom combination that kids can get. Adults can too, but we most commonly diagnose it in kids who get exposed to strep, and then they get tics or they get twitches or vocalizations, right? And we're finding that you can actually, for many kids, correct this using nervous system reprogramming. And so your doctor may be like, oh, this is hormonal. We can oftentimes correct hormonal by going and treating the nervous system. Or your doctor may say, oh, this is immune. This is all histamine or whatever they say it is. Well, oftentimes we can recalibrate that by doing nervous system reprogramming.
Yeah.
So I'd love to leave your audience with that 4-step process. Would that be okay?
Let's go for it.
Let's do it. Okay. So the very first step is you're going to either practice this 5 minutes every day, or you can use it when the moment calls for it. And the moment calling for it could be that you're under a lot of stress and you do have 3 minutes to take a pause and recalibrate. But for many of us, our lives are way too busy. And so you just have to schedule it in and just do it intentionally. A time when you can do it is if you're uninterrupted while brushing your teeth or when you're taking a shower. If you can do that, those are 2 times that usually are the best. And so, step number 1 is when we get activated, we see that changes happen in the brain that result in logical brain being shut down. We see the areas of the brain that get more activated would be associated with a default mode network. And so those parts of the brain are more ruminative. And so those thoughts, like I have all these symptoms and I'm thinking about them and I'm noticing them and I'm hyper aware of them, that's default mode. That's like autopilot. That's like my brain is just dwelling and I really can't make it stop and it's obsessing and I get that thought anxiety. It's like driving down the highway, cruise control, and you're not changing lanes. And so the very first step of the 4-step process is we want to activate your executive team. We want to activate your logical team, your dream team, your critical thinking team, the team that will enable you to be like, I'm not going to worry about worst case scenario. I'm going to change lanes and do something different. I'm going to take back my power. So the very first thing is I want you to practice getting back in your body. And so there's lots of ways that we can do this. One is practice the 3-3-3 rule. And so let's say you're in the shower. You practice, what are 3 things I can hear? Okay. I can hear my feet squeaking on the base of the tub. I can hear the shower. And when I tip my head, I can hear the water going into my ear. And what are 3 things that I can touch? I can let the water hit the palm of my hand. I can feel the way the warm water drips down the back of my neck. I can feel the way the breeze comes in through the edge of the curtain and it's cold and I want to press the curtain, right? Whatever it is, 3 things you can hear, feel, and touch. And feel and touch are the same thing. So let's say hear, see, and touch, right? If you're having a panic attack, let's say it's a really, really big moment, then use a panic pack. And so I've taught tons about panic packs and how to make them. So you could just Google panic pack. And these are going to have things in it that are going to help with the body when it's in crisis. And this is great too for kids. Like you're just like, I've left the room. I'm just in a sheer state of panic. So this is going to be like touch fidgets. This is going to be cold water packs. This is going to be warheads or ginger, like really powerful flavors. So that's step 1 is practice getting back in the body. Questions about that?
That makes sense to me because I've followed your content with the panic packs for so long, and within my own training with like somatics and hypnosis and trauma resolution, it is absolutely something that is part of those trainings. But I realize other people, like I think just the reminder that we're getting back in the body, we're activating the senses to get out of that vicious cycle that might be happening with anxiety.
Yeah, that loop, that vicious cycle, that loop that may be happening. So spend a couple of seconds doing that. It could be really quick. And then you're going to go to phase 2. And so phase 2 is we want to create more connections to the logical brain. And I'm really in love with havening for this. They used to call it amygdala de-amplification. But what we're finding is that when people go through a lot of stress in their lives, that they have a whole bunch of neurological roads or synaptic connections between events that happen than feeling in danger or feeling activated and triggered. So for example, if they had a bully and their bully wore Clinique Happy perfume in the 90s, now when they smell Clinique Happy perfume, the road in their brain is like, ooh, this perfume smell equals danger, right? So now we want to start recalibrating that. And amygdala de-amplification or havening teaches us how. So the second step is where we're going to onboard your logical brain. And I love to do that with the following exercise. So what you do is you notice something that may be a little stressful for you right now. So it could be going to my next IVF treatment. It could be maybe even having to go through ovulation and that process of sleeping with your partner and wondering every single time, is it going to work? That could be stressful. So you notice it, you feel it. If you're still standing in the shower, you just imagine it, just notice it. And then you do that for about 10 seconds. And then you do the amygdala de-amplification. So we just amplified it. We felt it. We noticed the yucky thing. And now we're going to make a road to your logical brain. We're going to break down that Clinique Happy bullying road. We're going to make a new road. So you're going to do a combination of 2 things. First is touch. And in havening, they teach about 3 ways you can. And so one is you take your hands and you imagine dusting the dirt off of your palms. And you do this kind of a gesture. And you do this for the whole second part. Or you can imagine dusting the dirt off of your shoulders. And the one that's more researched to be apparently more effective with amplitude readings is you can take your hands and it's almost like you're just stroking your face from your forehead down your cheeks down to your chin. And so while you do the touch, you're going to do cognitive exercises. So you're going to say your alphabet out loud. You're going to say A, B, C, D, E, F, G. You're going to say your whole alphabet. And then you're going to spell your name. And then you're going to imagine going into a grocery store and picking out 40 things from the grocery store. And then you're going to count backwards from 40 by twos. And so you noticed, you activated whatever that stressful thing is, and then you're pairing touch with things that are going to go to your executive team. You're making new connections. So you're going to do that like 3 to 5 times. So really quickly, and then I know we're coming at time here. So step number 1, get in your body using the rule of 3s, your panic pack. Step number 2 is you're going to practicing making roads between the activating thing and your logical brain. Now, step number 3 is you're going to practice bridging the gap between mind and body. So this is going to be, you're going to practice a little bit of mindfulness. You're going to practice noticing different parts of your body without needing to change them. Because if we can become more familiar with our bodies and pay more attention to our bodies, we can often hear its whispers before it starts to shout. And so spend maybe while you're soaping is just feeling different parts of your body and just noticing them. And then the last step, step 4, is arguably the most important. And I've been talking to a lot of experts lately about this step. And this step is where we actually expand our window of tolerance. This is where we allow ourselves to step out of our comfort zone and practice, because that's where the beautiful fertility comes in, right? Is where you practice getting aroused or activated, or you make yourself a little stressed, and then you rescue yourself. You get a little stressed, you rescue yourself. So this could be doing a high ropes course. You go up, you look down, woo, that's really high, really scary. I'm feeling my heart, I'm feeling my stomach, my thoughts, what if I fall? You just allow yourself to be up there for 2 minutes, and then you rescue yourself and you choose to get down. People are doing this with cold plunges, which sounds like hell on earth to me, but if that works for you, you get in the cold plunge, your body's going to get really activated. You see people are breathing, they're trying to calm themselves, even though it's really uncomfortable. And then they choose to get out of the cold water and rescue themselves. Some people do this with high intensity interval training. So you run really hard, you push really hard, your heart rate goes up, you feel your pulse, it's faster, and then you rescue yourself. You slow down into a walk. So that every time for the next 90 to 120 days, you've been practicing this, that when stress strikes and you need that skill the most, you will have it at the ready because you've practiced so many times. So those are the 4-step process for nervous system regulation, which I think would be, a 5-minute part of your healing routine, and none of those things cost you anything. So tell me.
I love when things don't have to cost people more money, and with this reprogramming and giving a skill, this is, extremely valuable for people who are going through something acutely stressful with fertility, but like the ripple effect of like using this in any other situation in life, being able to teach it to your children, being able to teach it to your partners, like this has a profound impact on how people move about the world. I do want clarification on step 4. So when you're activating that arousal system to rescue yourself from, what's the context for, like, are you still in the shower and you're imagining yourself, or are you finished with your, the step 3 and then you're taking yourself into a situation later on in the day that you can rescue yourself from? How does that actually play out in practice?
The way I would do it, if we want to keep this on the shower, is just turn the water to cold.
And there you go.
Which I'm so Vata in Ayurveda. I'm like cold all the time. And so it's like major cringe. But that would be a good way to keep it all in the shower. Is just be like, okay, I'm going to stress myself out a little bit. I'm going to put it on cold, but I'm only going to do it for 30 seconds. and then I'm going to go back to warm. And of course, you could tell yourself, well, there's also the benefit of alternating hot and cold hydrotherapy, which is great. And so, but you're choosing, you're like, okay, I can do hard things. I can feel stressed. I can feel yucky feelings, and I can know that I can survive it and I can be okay. And that's a great way to reprogram that power back into your nervous system, because it's all about giving you your power back. And dealing with struggles with fertility is really power stealing for people. So we want to start giving the power back, because the brain isn't great at the difference between imagination and reality. Yeah. And so if we start imagining that power, and we start imagining that we have the reality of being healthy and healing and listening to our bodies, then the body will start to change.
Yeah, it follows that blueprint.
Yes.
Yes. And it's reassuring for me and all of, the experts that I've interviewed, that there is such a common thread to that. So, with clients who've been working with me for a while, sometimes you start to feel like mom and you say something and they're like, oh, but then they hear it from someone else and they're like, oh, okay, well, they said it too, so I guess it must be true.
Exactly.
So I value that so much. I love that we have this really powerful takeaway. And for those of you listening, if you try these exercises, please let us know what you experience with them. So, drop in on Instagram, send us a DM, let us know what that experience was like for you moving through this. And definitely, I recommend people pick up the book. This is what it looks like. Shameless plug, because it's so beautifully done and so in alignment with how I feel we should approach all health issues, in looking at the whole person, their origin, their generations back story, and the literal physical environment that we live in as well. So I want to thank you, Dr. Nicole, for your time and for being here, for writing this beautiful book, for helping thousands of people move through anxiety and come out the other side with just so much more compassion and wisdom about their bodies. And where can people find you?
Yeah, come hang out with me on Instagram. I also have a holistic wellness collective. And so if you've heard these conversations and you're like, okay, I understand part of it, but I really need just a little bit of extra support or questions and answers, is I have a membership, and you can learn about that on Instagram, where people are in community with other people who are doing all of these steps and who are learning how to reprogram their nervous systems. And so that's a great place to come hang out with me too.
Awesome. Well, we will make sure that we have links to Dr. Nicole's website, the book, the quiz in our show notes for today. And if you wanted to learn more about the exercise that we did for heart rate and noticing the breath, check this video out on YouTube so that you can actually see the placement of how we were checking the pulse. And don't be shy. If you have questions and you want to learn more, you can reach out to Dr. Nicole on Instagram or through her website. And as always, I so appreciate you listeners so much. We value your experience, and we'd love to hear more about what you want to learn about. And if you want to take a moment to let us know what your biggest takeaway was and leave a review, rate the podcast. That helps more people get these amazing tools so that we can know that we're going to be okay. No matter what, we're going to get through this.
Yes. Yeah. Thanks for having me. I love your work. I love your podcast. It's amazing, and grateful to have been here and hanging out with you today.
Oh, ditto. And I just think it's so funny, like how full circle over we were trying to figure out before we hit record, like how many years has it been since we last talked? When was it that we first would have met in medical school? It's just so funny how small a world it truly is.
And how time flies, right?
Yeah, that too. I certainly don't, I don't want to age myself, but we've been at this for a while.
Just a minute, just a little bit.
Yeah. And I can't wait to see what the next, decade of progress in this work brings as well, to think, how much has been accomplished in such a short time. Truly, it's like, what does the next 10, 20 years get to bring as well?
Yeah. All right, everyone. Same time, same place, just a decade in the future.
I'm here for it.
Awesome. Well, thank you.